The patient walks through the door and it's, how much can I get? You know, ka-ching, ka-ching, ka-ching.
There was falsifying of patient records. There was billing Medicare for services that hadn't been provided.
The whole system is leaky and needs a complete revamp.
When 730 first exposed claims of widespread waste and over-servicing in the Medicare system, the joint investigation with the Sydney Morning Herald and The Age sparked anger from some doctors.
Having stories like this that are just patently untrue, ridiculous, are a total kick in the guts to the profession.
It also triggered a review into the integrity and compliance of the Medicare system, led by former Victorian Health Department Secretary Dr Pradeep Philip.
I was surprised by some of the challenges that the system faces. The fact we have such a complex system with around 6,000 Medicare items, over 500 million transactions a year, without the state-of-the-art control systems in place.
His report, released today, found the Medicare health funding system is unwieldy, unchecked and unfit for purpose.
So what we need to do is have a system that reduces errors, non-compliance, and a system that detects and deals with the bad apples in the system.
He estimates up to $3 billion per year in non-compliance, well short of the up to $8 billion Medicare academic Dr Margaret Foe claims is wasted.
I absolutely stand by my figure of up to 30% leakage across 3 distinct domains: fraud, over-servicing and error, and it is system-wide. I think the key difference in those figures is that I do this for a living.
The unfounded claims of $8 billion of fraud gave the medical profession a huge blow. They felt like they'd been hit by a bus, but this report vindicates their hard work and shows that the overwhelming majority of doctors are doing the right thing.
The report also found that much of the so-called leakage was a result of errors rather than premeditated fraud.
Does it matter if it's intentional or unintentional non-compliance? We're still talking about billions of taxpayer dollars.
So what the report shows is that Medicare is a complex system, and we do need to simplify that so that we can get the best possible value out of our Medicare dollars.
Much has been made of the number, but what's now clear is that Australia's universal healthcare system is in need of reform.
Dr Philip has described a broken mess. It is a scathing assessment of a system that has been neglected and left to wither and die on the vine over many, many years.
The report's recommendations included strengthening oversight and modernising payment systems.
There is no silver bullet that solves all of this. But if you do these things, then you reduce the amount of errors in the system and you give yourself a better chance of detecting fraud and dealing with it.
The system is so broken now that I actually think we need more than either Dr Philip or I have recommended. I think we need a root and branch reform and probably a royal commission.
The AMA says it's taking a close look at the recommendations, but it's already raised an objection to the proposal that it lose its veto power over who runs the regulatory body known as the PSR.
The AMA will be discussing that recommendation further with the Minister to make sure that we're doing everything we can to ensure that the profession continues to have trust in the regulator.
Isn't it more important that patients have trust in the system rather than that the profession has trust in the regulator?
Doctors and medical professionals are amongst the most trusted professionals in our society, and it is hugely important that patients continue to have trust in the high quality medical care that they receive in this country.
It just makes good sense. It's a power that hasn't been exercised, and it also doesn't seem right in this day and age that the professional group has a say over the appointment of the director of the regulator.
And your viewers would know at a time when it's harder than ever to see a doctor, every single dollar that goes into Medicare, funded by taxpayers, has to be spent wisely and appropriately.
Federal Health Minister Mark Butler says he'll review the recommendations and is committed to fixing Medicare.
Well, we're determined to act on this as soon as we appropriately can, and we're not going to let grass grow under our feet in responding to this report.
Despite debate over the system, the report concluded that the patients who pay for Medicare have at times been forgotten.
We talk a lot about patient-centred care, but what I see is doctor-centred care. And we need to shift that and start putting patients at the centre of all of our decision making, because it's their Medicare, they pay for it, and currently they are getting very poor value for money.
Patient care is of course at the centre of everything we do as doctors. Through this report, but also in strengthening Medicare Task Force and the other work that we're undertaking with government at the moment, patient care is at the centre of that.
At the end of the day, Medicare is a taxpayer-funded scheme to improve the health and well-being of Australians. So having that as the focus and having the system cater to that is absolutely critical for the future of the sustainability and effectiveness of our health system.